Good morning to all. I'm going to talk about how we can support persons with dementia living in the community during this COVID-19 pandemic. We are almost into a year of this COVID-19 pandemic and we have a lot to learn. For this lecture, I shall be describing persons with dementia living in the community, discuss the risk factors for COVID-19, the consequences and its impact, and what we can do to support persons with dementia in the community. Dementia is considered one of the most expensive conditions affecting older persons. Currently, there are 50 million persons living with dementia worldwide, and 60% of them live in developing countries, of which 60 to 85% live in communities in varying degrees of severity. They live together with their family or a friend, or in some cases alone, and their care is provided by the family member, a friend, relative, or a professional caregiver. And they require community-based supportive services to maintain their independence and well-being. What makes a person with dementia at risk for COVID-19? Dementia is more common among the older age group. Changes in the immune system occur in older persons, which make them susceptible to bacterial, viral, or fungal infections. They have multiple chronic diseases such as diabetes, hypertension, or heart disease. These conditions are also the risk factors for COVID-19. There are also the presence of behavioral disorders such as agitation or aggression. Their memory impairment will interfere with their ability to comply with the preventive measures for COVID-19, such as the frequent hand washing or wearing of face masks. It was previously reported that dementia in itself is not a risk factor for COVID-19. However, a very recent study reports that dementia is an independent risk factor for COVID-19, meaning that having dementia alone can cause COVID-19 or is a risk factor for COVID-19, and that persons with dementia are 2 times more likely to be at risk for COVID-19 than persons without dementia, and are associated with severe outcomes such as having severe pneumonia, requiring ventilatory support, being admitted for intensive care, or die. The World Health Organization declared COVID-19 a pandemic on March 11, 2020. In order to limit the spread, unprecedented restrictions were implemented by public health authorities. Quarantines or lockdowns were instituted. People were encouraged to self-isolate and practice physical distancing. Non-essential businesses, schools, churches were closed. Scheduled clinic appointments were canceled and access to health care was limited. For persons with dementia, the restrictions brought about by the pandemic resulted in the disruption of their usual routine or lifestyle, such as exercise, social, recreational, and rehabilitative activities, or change in their eating habits or type of food eaten because of changes in food availability. There is loss of the usual support system such as help in cleaning the house or personal care, respite, or adult daycare center visits. Home visits from family and friends are not feasible. The use of technology such as smartphones or video systems can pose a challenge and prevent them from effectively using these modalities. How then are persons with dementia affected by the restrictions? Lack of exercise, social, or recreational activities can cause a decline in physical and cognitive function. A lack of exercise also can cause deconditioning, resulting in weakness, frailty, falls, or physical dependence. Lack of social stimulation can lead to worsening or onset of behavioral disturbances. For those living alone, it can result in malnutrition, problems with personal hygiene or managing of medications, and even feelings of loneliness and abandonment. There can also be an increased risk of violence, neglect, or abuse by family members or caregivers. Acute medical conditions may not be attended, or not seen by a doctor, or even brought to a hospital because of fear of contracting COVID-19 infection. The memory impairment again will interfere with the ability to comply with preventive measures of COVID-19. And because of unfamiliarity with modern technology, persons with dementia may not be able to use or would have limited access to these modalities and have problems getting or understanding information about COVID-19. Another result of the restriction due to COVID-19 involves medication access and management. The physician is no longer accessible for face-to-face consultation and prescription of medications. Intake of medications may be discontinued, particularly for those living alone, because they are dependent for reminders and help with administration of their medications. There may be inability to access medications because of people who panic buy and stockpile medications, which leads to a shortage, and also because of the fear of going out to buy medications. All this lead to non-adherence, wherein a medication is not used by a patient at all or is used in the wrong way, such as wrong dosage or frequency of use. And this is a serious problem, as it increases the burden of illness, hospitalization, or even death. Knowing how persons with dementia are affected by COVID-19, we must also take into consideration how it affects their caregivers. Persons with dementia need high levels of care, which are most often provided by caregivers. Without them, persons with dementia would have poor quality of life and would be under institutional care. It has been reported that caring for persons with dementia is the most time-consuming for caregivers, and that caring for dementia is more stressful than caring for a person with a disability. They are under higher levels of stress and psychological distress and have poorer physical health. They suffer from more depression and anxiety disorders. They would have higher rates of worry, dread, or guilt. They have less time for self-care, such as sleep or exercise. They have more fatigue and more at risk for diseases. They have less time and space from their patients and therefore have less privacy. They have less time for socialization and fear of contracting COVID-19 and would prevent them from seeking help, medical consultation, or hospitalization for their patient. How do we support persons with dementia during this pandemic? We keep them active, we look after their general health, and have a routine. Keep them active physically through indoor or outdoor exercises, such as dancing, doing seated exercises, or Tai Chi. Mentally, by doing board games, doing puzzles together, or trivia knowledge. Teach a new skill like making a collage or knitting. And socially, through social media, by talking to close friends or relatives. Next is look after their health. Be alert and watchful for changes in behavior. Provide simple facts about COVID-19. and clear information on how to prevent infection in words that they can understand. Use plain language or illustrations and repeat the information when necessary in a respectful and patient manner. Demonstrate how to do proper hand washing and establish a pattern and routine. Create a step-by-step guide using drawings or pictures and place in the bathroom and other areas to serve as a reminder. Provide an adequate supply of alcohol, hand sanitizer, or tissues. Be aware of the symptoms of COVID-19, keeping in mind that older persons may not have the typical symptoms such as fever or cough. If the person with dementia has symptoms of COVID-19, the caregiver should call for medical help. And finally, have a routine. Make a to-do list, post a schedule where it can be easily seen. Regarding problems with medication, this can be accessed through telemedicine consultation. Physicians use telemedicine for the transmission of digital imaging, video consultations, and remote medical diagnosis. And patients no longer have to schedule an in-person visit with a physician to receive treatment. Another would be electronic or paperless prescribing. An accurate, error-free, and understandable prescription is sent electronically by the prescriber. Another is through continued dispensing, where an essential prescription-only medication is provided through a supply of a standard quantity, usually a 1-month supply, and by the use of delivery services. The pharmacy and the patient or the caregiver can avail of courier services for the delivery of their medications. Caregivers need to take care of themselves as well as get support from the community. They should eat a healthy diet, avoid drugs and alcohol, get enough sleep and exercise, establish and maintain a routine, take breaks from watching, reading, or listening to news about the pandemic, make time to relax, get in touch with family or friends, confide with a trusted friend, reach out to a support group, and encourage them to ask help from the community, and consult with a health professional or plan for emergencies in case of illness. This ends my lecture on how to support persons with dementia living in the community. Thank you for listening.